my colleagues on the panel and learned friends. Because my way of presentation is likely to be a little different, as just rightly indicated, because we are not very much familiar with these sort of activities. We are doing practice in our own way in Kerala. So, can you hear me now? Okay. Now we are doing Ayurveda. Primarily, what I have to tell you is, Ayurveda is practiced in our hospital as a primary treatment procedure. It has never been an alternative or complementary or adjuvant therapy. That's the first thing I have to tell you. And it's also a fact that this hospital is perceived more as a referral hospital where chronic patients come after undergoing prolonged various therapies earlier. I would like to read it out because if I speak very slowly, it may take a little more time. So Madam has cautioned me to take not much time. So I would like to read it out to make it a little more fast. Now, our hospital at Kottakkal has the capacity to accommodate 350 patients at a time. On an average, our annual admission is 4,300 patients. We are dealing with more than 49,000 patients at our OPD every year. When we look at the patient pattern, from Kerala we are getting 22%, from rest of India 48%, from Europe and US 10%, from Middle East 15%, and others 5%. Actually, we are getting patients from 80 countries. They come and stay in our hospital. So I don't want to go to the details. Now, my idea is to present a few cases before you, which will give you an example, which will give you an insight in which way we are dealing the cases there. Let me start with an avascular necrosis case. This is a disease where there is a cellular death of bone components due to interruption of blood supply. It's most commonly seen in affecting the hip joint. Total hip replacement or similar invasive procedures are generally adopted for the management of the case. A case of avascular necrosis was referred to us by an orthopedic surgeon a few years back. Since the patient was 7 years old child, surgical option was not recommended as a first option by the patient's doctor. The child was provided with classical Ayurvedic treatment consisting of appropriate oral medicine, therapeutic massage helpful to improve the growth and consistency of bone components. Actually, orthopedician was reviewing the case periodically. Gradual but remarkable radiological changes were observed and recorded by the orthopedician. The boy's parents were advised to continue with Ayurvedic treatment by the orthopedician. In due course, the patient did achieve a near normal condition. He is now 19 years old and maintains good health. In this case, we were depending both on radiological changes and functional status of the patient to assess the improvement. The therapy provided by us was exclusively Ayurvedic. But the boy's orthopedician made periodic assessment of this condition. This approach seems to be a very ideal one when it comes to integration. Now, I have to sound a word of caution here. Such objectively measurable results are not always available. A best example is the study we conducted in IVDP cases, intervertebral disc prolapse cases, supported by WHO in the year 2010. The study results established the capacity of Ayurvedic treatment in the management of IVDP cases. But MRI reports showed changes only in 10% of the cases. But more than 70% of the patients reported relief from all major symptoms of the ailment. This is an area where there could be some conflict of opinion. Incidentally, I would like to mention that a good number of cases admitted in our hospital Kottakkal are IVDP or other discogenic diseases now. Based on the MRI findings, many of them get advised to undergo surgery to saturate the condition. However, since there is a disinclination for surgery among the Indians, they prefer to try alternative treatments. As per our finding, more than 70% of the IVDP cases receiving appropriate Ayurvedic therapy recover remarkably and are able to resume their routine work. The role of modern medicine is quite relevant in the acute condition of IVDP. Most of the patients require administration of modern analgesic with or without traction for the pain management. Similarly, assessment of an orthopedic surgeon and rarely a neurologist become necessary to decide as to whether surgery can be safely kept in reserve, giving a decent time for trying Ayurvedic treatments. If the initial assessment is incomplete or the decision is prejudiced, patient will be denied of the medical justice. So mutual respect, as has been rightly pointed out by Dr. Geeta Krishnan, a mutual respect and understanding between the members of the medical panel is absolutely essential. Now, let me talk about a cancer case. A 61-year-old female patient reported at our cancer clinic in February 2008. Her case was diagnosed by oncologist as CA lung, secondary deposit of adenocarcinoma, poorly differentiated, primary unknown. These are the details of it. The patient wanted, here the decision was taken by the patient. Patient wanted to discontinue her course of chemotherapy and switch over to Ayurveda. She could complete only 4 cycles of chemotherapy out of the 12 planned by the oncologist because of the unbearable physical and mental strain involved. Our attempts to persuade her to complete the course of chemotherapy did not succeed. Responding to her insistence, she was put on an Ayurvedic anti-cancer treatment regimen, which we have involved over a period of time. Her condition was reviewed at monthly intervals. Except for occasional respiratory symptoms, she is maintaining fairly good health for the last 5 years. Her previous visit to our outpatient was in the last month, 18/3/2013. It has been our inference that Ayurvedic treatment could be considered as a second best treatment option, especially in cases where chemotherapy does not suit well with the patient. Again, one more point, I am just talking about the area of integration. A 2-year-old female baby abruptly developed fever with severe multiple joint pain and swelling on major joints. The child lost appetite of food, sleep, and bowel movements. Gradually, her joints, especially knees and ankles, showed some early signs of deformity. The case was seen by allopathic doctors and diagnosed as juvenile arthritis after relevant investigations. Her condition was managed conventionally using painkillers and adjuvant medicaments. As painkillers did not provide long-term benefit, she was put on disease-modifying anti-rheumatoid drugs, methotrexate and all that. Introduction of the second line of treatment led to few complications. Her liver function started showing signs of liver damage. Doctors were forced to confine the treatment to painkillers alone. It was at this stage she got admitted to our hospital. Patient was primarily put on appropriate medicines to improve liver function. That is very important for us because we have to give all the medicines by mouth. It has to be digested, assimilated, absorbed, and metabolized. So our entry point is through mouth. So we have to set right the digestive system perfect. That was our prime aim. Immunity and to improve our liver function and immunity, and I was asked to retain the minimum dose of NSAIDs, which was essential to control the severity of the pain. She was given nutritionally balanced diet. Within a period of 3 weeks, the liver function as well as the general condition of the child improved. But the joints pain and deformity persisted to some extent. The case was referred back to rheumatologist in the best interest of the patient. Rheumatologist issued a classical prescription including DMRIDs and also advised to continue Ayurvedic treatment. This result in her condition steadily improving. She has now started her schooling. Ayurvedic medicine with minimum support of allopathic drugs maintain her health. She visits both allopathic and Ayurvedic doctors periodically to receive advice. Both the doctors respect the views of each other and work to the advantage of the patient. This is only an example. When we deal with the rheumatoid arthritis cases, in fact, we conducted some research studies on rheumatoid arthritis under the guidance of a rheumatologist. He also holds the same view. Ayurvedic treatment is effective. It is better than conventional physiotherapy. Oil massage therapy is better than conventional physiotherapy. And also, if you administer Vasti or such treatment, Panchakarma therapy, it will definitely help to arrest the deterioration of the case. That is one area. And again, this is from some other point. I am citing example of another case. A 59-year-old lady was under Ayurvedic treatment for a fairly long period. Ayurvedic physicians were under the impression that she was suffering from severe form of osteoarthritis. She also had diabetes mellitus and hypertension. Since the improvement was not satisfactory, she was referred to Kottakkal. Unfortunately, we could not arrive at definite conclusion about her diagnosis. We decided to refer the case to a neurologist who always maintained a favorable inclination towards Ayurvedic treatment. The neurologist arrived at a very comprehensive diagnosis. In addition to the arthritis, she had peripheral neuropathy, proximal myopathy, and early myelopathy. After giving a short course of allopathic treatment for immediate palliation, the neurologist sent her back to us, advising to undergo Ayurvedic therapies on a regular basis. This open approach and advice of the neurologist gave the patient immense faith in Ayurvedic treatment. She presently takes minimum allopathic drugs for the management of diabetes mellitus and hypertension, along with regular Ayurvedic treatment. Her condition improved satisfactorily after undergoing classical Ayurvedic and Panchakarma treatment. She makes it a point to spend at least 2 weeks every year in the hospital in order to maintain the improvement. She does not forget to visit neurologists also once in a while. I have brought out a few cases because I know the time is very limited, so I don't want to dwell upon other cases. We will discuss about it later. Finally, what I have to tell you is integration as a concept and as a methodology is understood and practiced in our hospital. It is more at the knowledge building level rather than the therapeutic level. That is the point I would like to convey specifically. It is more at the knowledge building level. That is possible. The physicians of our hospital, right down from the chief physician, have to come to terms with diagnostic and therapeutic methods of modern medicine because the patients coming here are chronic ones carrying large volumes of previous clinical papers. As a result of trying to understand the clinical reports, the knowledge level of our physicians naturally undergoes a process of integration. There is a constant updating that takes place. But the therapy is exclusively designed, executed, and reviewed on Ayurvedic platform. System shuttling, doctor shopping, concurrent uses of medicine and therapies of different medical systems are to be accepted as realities developed as a result of medical pluralism. However, there is no formal or scientifically accepted protocol to follow in this regard at present. Let us hope that this would be evolved through open-minded discussion like this. Initially, the therapy, we were all feeling that it's desirable, then we felt it good, now necessary, needed, essential, now it has become unavoidable. Though this appears to be a very good initiative, and our institution is very much for it. Thank you very much.